Hi, I'm Carrie O'Toole. Welcome back to Broken and Brilliant. I'm here with Dr. Larry Sanders. Thank you so much for coming.
Absolutely.
I'm just really excited to have you here. We have had many chats over the years, and we were just saying that we could probably sit here for 24 hours and have a new topic every 20 minutes. So I'm excited to see where this goes. I think we're just going to kind of let it flow organically and see where it goes. But you were going to tell a story about starting your residency.
Yes. Yeah, it's very interesting. I became a psychiatrist because of the funniest thing, not the funniest, but the oddest thing, because I grew up with a very crazy family. And looking back, I've always had this interest of why do people do what they do, especially when it appears to make no sense. But I know these people are not like out of their head. They're just doing things that don't make any sense to us. But they're not irrational people. So I've always been curious about why people do what they do. But one of the revelations really came to me was when I was interviewing for my psychiatric residency. After we did the formal interview, the residency director said, "So what's your story? Why do you want to become a psychiatrist?" And I was an older student and not very intimidated, so I thought that was a little intrusive. And so I said, "Why do you want to know?" And he says, "Because if you haven't lived it, you can't understand it." And at the time I thought, wow, that's profound. I mean, it really is. And so I realized in looking back on my life, I think God was preparing me to become a psychiatrist from way back because of a lot of things that happened. Like I moved from rural Arkansas to Los Angeles and then back to rural Arkansas, an experience most people never had. And then when I went into junior high school, the 6th grade teacher I had was very strong in some subjects and very poor in others. So they ended up splitting me up unlike anybody else's schedule. So I've always had this like different schedule, always kind of doing it differently than anyone else has. And that really does train you to be able to do things differently. Because otherwise people tend to want to follow the crowd. They're more comfortable with that. Well, that wasn't laid out for me.
Never works that way.
But what the residency director said is really true, which is what I've experienced in my life, and I've been a psychiatrist now, I guess 27 years considered in addition to residency. And I've done 18 years of therapy myself with about 13 different therapists. 2 were great, 3 or 4 were mediocre, and the rest were useless or even damaging. And as I observe people, observe therapists...
Me too, by the way.
Unfortunately, about 2/3 of people are not very good because you learn by your experiences. If you've never had really challenging experiences, then you really don't know the depth of what that does to people. So I have found that the best therapists are people who've had very significant challenges in life and have worked through them. And we'll talk about what that means. Mediocre therapists have never really had any big issues, but they have a lot of book knowledge.
And they want to help people.
They do. But sometimes their ability to understand and empathize, they just don't have it because they don't have any experience. So like, for example, a colleague of mine who's part Asian, came from a very well-to-do family, and I don't know of any struggles she's had in her life. And she started working at the Asian Center and was talking with the Vietnamese boat people where horrible things happened to them. I mean, just horrible things. The communists were treating them horribly. I mean, like wicked things like disemboweling your kids in front of you and raping children and just ugly stuff. And then if you could make it to the coast and get on a boat and hopefully drift towards Thailand, the Thai fishermen would come aboard and abuse people and stuff. And so PTSD in them is about 70%, by the way.
Wow.
Yeah, it's really tremendous. But so when they got here and trying to deal with their PTSD, she would listen to them and she says, when they tell me their story, I feel a little sad. You go, a little sad? My gosh, that's just gut-wrenching. But that was the depth of her experience. And so what the residency director said, if you haven't lived it, you can't understand it, is true. Now, vice versa, the people who are the poorest therapists are the ones who've had significant issues but have not worked through them. Because then as you start talking to them about your stuff, it triggers their stuff, and they will skirt you around that so that they don't get triggered.
Right. I remember that from grad school. I mean, when they put us in groups and they said, you know, you better know what you've worked through and what you haven't, because if you haven't dealt with something in your own life and you have a client who comes in, you will actually not help them. You'll be harmful to them, because it will make you uncomfortable, so you won't help them through it.
Right.
Yeah.
You'll even try to get them to not deal with it. And so those therapists tend to be what I call professional handholders. You know, they'll commiserate with how bad it is because they feel it themselves, but they can't help you because they haven't helped themselves. So they really don't understand how to get better. They understand about suffering, but they don't understand how to get better. And so they keep you stuck. But a lot of people stay in those kinds of therapies because somebody understands me. Somebody cares about me.
They finally don't feel alone.
But 3 years later, and you've been spending, you know, $100 to $200 a session, and your pocketbook's feeling it, and you're going, wow, I'm not doing any better.
I have a nice little friend here who I can talk to once a week.
The best friend that money can buy, right? So what does working through it mean? The biggest part about working through it is really, the key word is functionality. How well are you functioning? And if you really look at it, that's really what we're looking for. It's, do we do well with our work or our school? Do we do well in our family relationships? Do we do well in our social relationships? That's the DSM-5 diagnosis of functioning.
And DSM-5,
oh, I'm sorry. It's the Diagnostic and Statistical Manual for Diagnosing Psychiatric Illness. And it's the newest copy of it, the newest rendition of it. And so that's where we make all of our psychiatric diagnoses, based on the symptoms there. And you know, always category A is symptoms, category B is not caused by another condition, and then category C is must cause significant dysfunction. So, you know, the first thing when you say, you know, working through, how well are you functioning?
Well, what if somebody thinks they're functioning just fine, but others in their lives would say, well,
that's a place
let's say they don't have any insight, or they don't
That's a place where Freud got it right. Okay? Freud, I think, was totally wrong about the Oedipal complex and all that sort of stuff. But he also discovered and named every defense mechanism. And so people get into these defense mechanisms, and that's exactly what happens when you haven't dealt with something. When uncomfortable feelings come up, something has to happen. So you will defend against it. You'll suppress it. You'll deny it. The most extreme one is called reaction formation. So let's say a person, when they're confronted in a situation and they're frightened, they become hostile as a way of dealing with it, where other people won't. So what happens is you'll have dysfunctional behaviors. And the defense mechanisms are in 3 categories. There's the mature, the immature, and then the psychotic kinds. Unfortunately, in the mature, there's only 8 of them. And in the immature, there's about 20 or so. So first of all, when you are not dealing with it, you'll come across as dysfunctional. So how would that look? It could look like anything. But for example, if we look at like the work of Scott Stanley, who he followed 135 couples for 9 years and found success of your relationship did not depend on how happy you were, it depended on how well you resolve your conflicts. So if you have issues that you haven't resolved, it'll usually come up as poor conflict resolution. So what did he find? He found that people withdraw, so that's denial or suppression. People get escalated, so that's when you're starting to attack people. People will minimize. From as subtle as you shouldn't feel that way, you shouldn't think that way, to name calling like you're stupid, you're an idiot, whatever. And then there's something called negative interpretation, whereas because you're not dealing with your own issue, you'll project that onto somebody else. It's not me, it's them.
Right.
And then you'll say, okay, They really don't care about me, and occasionally you'll see behavior that reinforces that belief, even though it may not be true and you've never discussed it with them. It'll seem true to you, and then you have this perception about them because it guards you from dealing with your own stuff. And so working through is really about understanding the dysfunctional behaviors. And the first thing people have to do is to own it. The biggest thing we do is point fingers. Because, and it's interesting, because when you think about it, the most common emotion that people feel is anger. Anger is a secondary emotion to a primary vulnerable feeling you're not comfortable with yourself. So let's say I feel helpless, I feel guilt, I feel shame, and I don't tolerate that, I'll attack you. Well, you shouldn't say that. You shouldn't do that. You're triggering me.
And that's not even really the feeling.
No, it isn't. And so I have to own those things. And so the first thing is you have to own things. If when you find yourself blaming others for the way you feel, that's when you know you're in a victim state. Well, if you're in a victim state, I'll tell you that at one time you felt like a victim. And victim state is very comfortable because it feels right. And
well,
maybe
and it
we're
was
wrong.
true.
It was true.
Absolutely it was. And I think that's the biggest thing that people have a struggle with is they were victimized at one point. And as a child, when you feel like a victim, you do all of these things to survive. But then as you grow up, and nobody has taught you how to own your stuff, and it wasn't even your stuff, it was other people's stuff that was put upon you. So then you grow up and all of a sudden it's like, stop being a victim. Well, that feels really harsh, and it feels really mean, almost like, well, what about that little person in there? So what do you do with that?
Well, that was one of the hardest things for me in therapy to deal with, because I had been victimized. And it finally took me to understand that wasn't really the issue. The issue was not have you been victimized or not. The issue is how you're going to deal with that. And when you're a victim, you're basically saying somebody else is responsible, so they have to change before I can change. Well, good luck with that, because if they cared, they'd already tried to have done something. So if you hold on to that, you're only hurting yourself. Max Lucado did a great talk at Promise Keepers 1997 in Denver on holding on to old hurts. Holding on to old hurts hurts you. Do you think they really get hurt? They don't care.
Some of them are dead. Yeah.
And if they did care, they had to try to resolve it with you. So holding on to old hurts hurts you. But I like what Mother Teresa said even better. She said, when someone does wrong to you, in the end, they're accountable to God for that. And how you respond to them, you're accountable to God for that. Like Jesus said, turn the other cheek. It means you have to take ownership for your behaviors. You can't justify them. And so it really means working through things means taking ownership for your behaviors. And even though you were wronged, that's irrelevant. The relevant thing is, okay, now that I was wronged and I have these feelings and I have these perceptions about myself and my perceptions about others that aren't working for me, what do I need to do to make my life more functional? How can I have better relationships?
Now, would that include going back, and I don't mean like reverting or anything like that, but like going back and looking at the pain that happened to you and at least acknowledging it and saying, yeah, that was real. That
it really depends on what happened to you and how your brain processes things.
So it's different with different people?
Different with different people. So for example, some people develop these negative distortions. So like, let's say you go out to your car and you have a flat. Well, some people get mad and kick the car and say, why do bad things always happen to me? Okay, there is an overgeneralization, which is one of the cognitive behavioral. There's 10 cognitive distortions that are really worth looking at. Even no matter what kind of therapy you do, it's worth starting out with cognitive behavioral because it helps you to identify them.
And that's what you're thinking and how it causes you to act.
Feel. So cognitive behavioral therapy basically is a type of therapy that's been around for several decades and it's been really tested a lot in the treatment of lots of conditions, but especially depression and also with anxiety, but primarily depression. And basically cognitive behavioral therapy at its roots says how you think is how you feel. So, and when you start looking at it, it actually makes a lot of sense. And what I like about cognitive therapy is it's easy to understand, it's pretty easy to apply, and you get really great results. I mean, there's books out on cognitive therapy. Probably the most famous one is one called Feeling Good by David Burns, and it will show you exactly what you need to do. And if you actually follow it and write it out, not just think about it, it can make really impressive changes in how you process. So a classic thing in cognitive behavioral therapy is you go outside and you see a flat and you get mad and you say, why do bad things always happen to me? Well, cognitive therapy would tell you is, okay, let's look at this in a more full light, and rather than overgeneralization. Because most times when you walk out there, you don't have a flat tire. And flat tires happen to everybody occasionally. So when you come to that rational conclusion, now you look, okay, now how do I feel? So before I was depressed or angry or whatever, now I say, oh, you know, it's just the price of driving a car.
Yeah.
You know, I mean, things happen. And so cognitive therapy really helps give you skills to work through things. And I like psychodynamic therapy a great deal myself. But I was very frustrated working in psychodynamic therapy
and
because...
just give a quick description of what that is.
Thank you. Psychodynamic therapy, again, in the base, it's kind of a... it's a modified version of psychoanalytic therapy, which is Freud did. But really, psychodynamic therapy is working through old conflicts. So a trauma happened to you. How do you feel about it? How do you perceive yourself because of it? And then by looking at it from adult perspective, how do you feel now? So something bad happened to you as a child. Children don't have the ability for abstract thinking. So they can't step outside themselves and say, look at this. So they assume everything is because of them. And you carry that same perception until you do something about it. No matter if you're 70 years old, you still carry that same perception. And so what psychodynamic therapy does is help you go back and look at those things from an adult perspective now that you do have the ability for abstract thinking and looking at this from a different point of view. And now you develop a different perception of yourself. And to me, that's what really makes change. Because I've seen a lot of people with cognitive therapy do great while they're practicing it, but if they never change their self-perception and they stop doing cognitive therapy, they slide back down.
So it can last for a little while, but if they don't do that other work. Okay.
Yes. That's my perception. Now, dyed-in-the-wool cognitive therapists will disagree with me, but you know what?
I remember the first time I heard somebody say, change your thinking, and that blew my mind.
Yes.
Because, you know, you have thoughts, and they go through your mind, and you believe them to be true.
Yes.
And you don't realize that they're in, you know, your brain is impacted by stuff. I remember just recently going to a conference and heard your brain is just an organ and it's just digesting stuff. I was like, you know, and that's after all these years. I'm still hearing this as if it's the first time. And it's like you can actually stop yourself from thinking something and change how you think. That was so revolutionary to me. I still struggle with it some. It's not something that happens overnight.
And we may never get 100% right, but the fact is we keep getting better and better.
And that's what really working on it means.
That's right.
To a certain extent.
And a lot of people will say, you know, how do I know when I'm done with therapy? Well, in reality, none of us are perfect, so we all could get better, but it's kind of the diminishing returns. You know, if you put in a year's worth of effort and you get 50% better, and then another year you get 25% better, and another year you get 12% better. At what point are you good enough? And that's where the functioning thing comes in. Are you doing well at work or school? Are you doing well in your family life? Are you doing well in your social relationships? Are you a productive member of society as you perceive yourself and doing things that help yourself in society? If you're doing those, that's normal. Normal doesn't mean perfect. Normal means I don't overreact to things. I recognize when I do overreact, so it's not exaggerated overreaction. So it's like my patients who I treat that have bipolar disorder have really struggles with this overreaction. And then they'll tell me, well, something really bad happened and I felt depressed. And I say, well, how depressed did you get and for how long? Well, I felt kind of down for half a day. That's normal. That's normal. I don't want you to be a robot. I want you to be back to normal. It would be strange if you didn't react to something that's negative. But it's that we don't overreact, we don't dwell on it, we don't do dysfunctional behavior.
Either, where there's just your flat line.
Yeah. because then that'll kill your relationship ability. You know, somebody tells you something, you just sit there like a robot. Yeah.
Whatever. Sorry you feel that way about me.
And it's funny, in my treating patients with medications, both depression and bipolar disorder, some of the medications can make people feel that flat. That a lot of docs say, well, that's good, you're not having symptoms. It's not good. It's better than being really dysfunctional, but you're still not normal. So I tell people, I want you to be stable and normal. I want you to have normal reactions to things. I want you to feel love. I want you to feel happiness. I want you to feel sadness. I want you to feel things. I just don't want it to be exaggerated and extended. Just have your normal reactions like the average person. That's when you're doing awesome.
You know, talk about meds for just a few minutes here. There's so many people who are totally anti any type of psychotic medications. Why is that? And what do you think about that? And are there some things that can be treated without using meds?
Good point. All of those. That's probably another hour talk, but we'll try to distill it down.
Do it in 5 minutes. No, I'm just kidding.
You know, what we're taught is that every condition, you need to look at the biological, psychological, and social impact. Where did this come from? Was it more of a biological thing, like a disease of your brain, like schizophrenia or something? Was it biological, old issues that you still haven't dealt with?
So maybe trauma from childhood or something like that.
Social things, current stressors, you know, did you suddenly lose your job, or does your spouse want a divorce, or you suddenly have a child who's gotten in trouble or something. All of those things will impact us, and normally they should. So we look at what was the cause. That will help you know, oh, by the way, since I'm Christian, I also believe there's spiritual components. And that will help us to know what do we need to do. Because many times biological things need medications. Not always, but many things. Whereas many times psychological or situational current things, they need more psychotherapy. Meds will help you tolerate it better, but they probably won't fix it.
Right.
Because it's not really a biological condition.
Well, and that's why when people who have depression go to their medical doctor and ask for, you know, some type of a medication to help with the depression, and they don't seek therapy, they just end up staying on the meds forever because they can't make that feeling go away, and they can't get themselves back up to normal. Whereas that's not what it's designed for, correct? It's designed for a short period of time while you're going through therapy to help you work through that, if that's what the case. In
some cases. You bring up depression. Depression is kind of a tricky one because true major depression, if you've had one episode, the chance of another one's 50%. If you've had two, the chance of another one's 75%. 3, 95%. 4, 99+%. So at some point, if you've had several true major depressions where you're truly dysfunctional for at least 2 weeks, you're going to need meds for a lifetime. But if you do it early and do therapy, you may be able to avoid needing medications for a lifetime. Because certainly, every time you have an episode, your brain atrophies. So it's really about preventing episodes, whatever method. And what we find in therapy is, if someone's significantly depressed, they're so depressed they can't do therapy. They can't really process and understand what's going on. So they truly need medications. And sharp therapists will see that and say, hey, you know what, let's get you on medications so your brain can function well enough to understand and deal with what we're trying to deal with. Now, mild to moderate depression, psychotherapy is usually all you need. But so what I say is, my kind of metaphor is that medications are like the foundation of a house. Because if the chemistry in your brain is not right, you can't build from it. And so a foundation of a house you build from, because if it's not there, you can't build. But a foundation is not a house. You usually have to build from that. And so it depends on the condition a person has as to whether they need medication short-term, long-term, constantly, intermittently. But as with every condition, the earlier you recognize it and the earlier you treat it, the better results you get. So for example, if you've been depressed for 3 or 4 months and you get treatment, your chances of getting well are far greater.
Than if you've been depressed for 6 years and 20 years.
I was talking to a researcher one time, and he was seeing a guy who had been depressed for 5 years, and significantly depressed. And he said statistically the guy's chance of getting well is 4%. Because as we are depressed and stressed, we release glucocorticoids, which try to help decrease inflammation, because depression is very closely linked to inflammation. And that works short term, but it prevents your brain from regenerating itself. And so you start to get atrophy in serotonin-sensitive areas, about 20 areas. And so at some point, your brain literally has shrunk, and you can't do what you used to be able to do. And when you're on medications, it helps to regrow that. Interestingly, psychotherapy does the same thing. I found the most amazing coincidence, or it's not a coincidence, which is medications work about 70% of the time. Therapy works about 70% of the time. That's either an amazing coincidence or they both have the same final common pathway, which is medications stimulate neurons to fire, which releases a growth factor called brain-derived neurotrophic factor, BDNF, which makes these neurons regrow. Therapy stimulates neurons to fire, which releases BDNF, which causes them to grow. So it depends on the condition, but by and large, they both work. And most studies show for most conditions, both work better than either one alone.
So if you put them together.
Put them together. There's a couple of exceptions to that, like perhaps in panic disorder. But by and large, if you do both, you're going to do better than either alone. But certainly if you have a significant illness where it's affecting your functioning, you need medications, because otherwise you don't have the ability. You literally don't have the capacity to. It's my metaphor I give to patients is, bench press and then put your arms in a cast for a month and then see if you can bench press the same amount. You can't. Your arms have atrophied. Your muscles have atrophied. And so you need something to help you get over that atrophy state.
So if your brain has not been functioning the way that it needed to and it atrophied in certain areas, this will help regrow.
Correct.
And restart up. That's what's so amazing about the brain is even though we're a little older, it can still change.
Yes.
It's not like once you hit age 12 or whatever, your brain stops growing. It continues, and you can continue to regrow, and you can continue healing no matter what age you're at.
Yes.
That's what I think is so cool.
It is cool. And it's interesting, we used to think the brain was static. It didn't change. And it turns out that some parts are static and some are not. Some constantly are responding to your environment. So there's a really cool thing called epigenetics, where you have genes that are expressed to help you tolerate the world. They produce regulatory proteins. If your body senses that you're getting really stressed out, so you're not coping well, it will shut off certain genes and open up other genes to try to respond in a better way. And so this epigenetics also helps us respond to our environment, hopefully better, but certainly differently. So yeah, the brain is constantly adjusting to make you better respond to your environment than you were able to before.
Well, I've learned some things about addiction and how it can form pathways that are not healthy in your brain. And when you start starving those pathways, you can actually grow back the healthy pathways.
Because when you don't use those pathways, you stop producing BDNF, so they atrophy. And you use healthy pathways, they produce BDNF and they grow. And so psychotherapy, it's like if you've got really thick dysfunctional and small healthy, you work in therapy, this grows, but this shrinks, but this is still the major one. You're still going to be doing dysfunctional things. And you work longer and this grows and this shrinks. It's only when this becomes dominant now suddenly that's the change that everybody sees. Now a lot of people, especially in Hollywood movies, have made this, they think it's the last thing you did. It's everything you've done. It's like going up steps. It's not just one thing, it was several things. And so I've even noticed over the years that I start looking for small indicators to help people, because therapy does take a long time a lot of times, but small indicators. So if you even paused before you did your dysfunctional behavior, that's different. That's better. Something stopped you a little bit.
If you're aware.
Yes, you're aware.
There's some where you might even start looking at how did my behavior impact those other people. You start making that distinction that it's not all about me, but wow, I impact other people. How did I noticed they flinched when I spoke. Those little things where you start having some recognition about how you impact other people, about how other people impact you. That can be just one of those small steps.
Oh yeah, that's probably further along. I even look for just a pause or a thought in a different way, even if it's transient. But that's telling me that they're starting to grow that. And then they start to even say, wow, maybe I'm doing this. That's the biggest thing. When they stop saying you and start saying I, you've made a huge change, because now you're owning it, so therefore now you can control it. What victims don't understand is as long as they blame somebody else, that person's still in control. It's only when you own it can you start to make choices and start to control it. So yeah, it's an amazing area and just keeps growing and growing our understanding of brain and behavior.
Yeah. Well, Larry, it's been so interesting talking about brains. I remember, so by the way, you were my psychiatrist for a while and helped me through one of those situational periods of depression, anxiety, sleeplessness. And it was a very, very scary time for me. And I remember coming in and the first thing I said to you was, I'm terrified to be here because I think you're going to tell me I'm crazy. And you said, that's not even a check off on the diagnostic list. Phew, okay, well then we're good, as long as I'm not crazy, because I really felt like I was, and it was a very scary time.
And crazy people are the ones who don't seek treatment.
Well, true. Okay, so there you go. I'm officially, could you say it one more time?
Crazy people
She is not crazy. Tell them all, I'm not gonna, just kidding. But anyway, thank you so much for being here, and we're going to have you back on another edition, and thank you all for joining us today on Broken and Brilliant.
Thank you.